One of the most challenging things we do as dentists is help patients make good decisions, help them understand why chewing and smiling with confidence is so important. Because you may not realize this if you're not a dentist. Many people don't like us. Many people don't want what we are selling. And this can be a struggle for dentists at any age and stage, whether you're 1 year out of dental school or been dentisting for decades. I'm so proud to have my friend and sponsor, Dr. Spencer Greer, here with me, talking about his program to help with this. Dr. Spencer, just give our audience an overview of why you created this program and the type of impact it has on dentists.
Yeah, I'm Dr. Spencer Greer. I'm a practicing dentist in Washington State. I'm from Arizona. And, becoming a dentist was something that was pretty unplanned. It happened after I graduated from college. And this was something that I experienced in the chair myself. It was when I was in the chair and the guy showed me that I had these cavities that needed to be fixed. That was the first moment that I felt, oh my gosh, I think this needs to be my career. That was really hard to get back into it. It was really hard to get back into school and to get the knowledge. I forgot everything about OChem on purpose, and I just really wanted to become something good, something great, somebody who contributes well. And even though a cardiac surgeon sounded cool, sounded stressful. So I wanted something with a little bit less of a professional obligation. As I've become a dentist and I've gone through a lot of the situations that have taught me lessons the hard way, I've realized through bettering the lives of my associates as in good income earning doctors, having a great balance of life to where they don't have to manage the difficulties of ownership at home. I'm so excited for them and the quality of life that we have been able to produce for them. And so this is something that you or other dentists can really benefit from in order to maximize your earnings, really decrease the sadness of it because too many doctors are just kind of sitting in the norm, sitting in the average. And that's just not fun. Being in the average is not fun. That's where the tears come. If you're an owner and you're just kind of getting the average, you're just like, what am I doing all this for? If you're an associate and you're making just kind of the average, you're just like, why aren't I making more? Should I own or should I do a different associateship? Like, why can't we just look at where we are and better from within? Right? It's like those dentists who own one practice and they're like, should I have five? Right? And so then they start seeing like, okay, dollar signs, dollar signs. Well, what's within the system right now? Where can you make that maximized? That's where I come in. It's like, let's not look beyond too much. Let's just look within and really just help you to if you're at this level, let's get you to this level. If you're at this level, let's just keep it
I
going.
love what you're sharing, Spencer. I'm going to interject. I say interject with brilliant ideas. I don't interrupt. Don't ask my wife about that. I just interject. And I want you to share with our audience, because I really love your story so far. What's stopping associates and owners from doing that now? As I ask you this question, this morning I had the opportunity to speak to 80 D3 dental students on Zoom. And I
Wow.
said, the answer to this question in your life is always the same. How do I retire when I want to retire? How do I enjoy dentistry more? How do I get people to have confidence in me? How do I own a great practice? How do I get a great job? And the answer is case acceptance to every one of those challenges. And it's not talked about enough in school or at all. So what's stopping these dentists when they might be in a good place, like you said, they're producing $2,000 a day. When you work with these dentists, where do you see this, whether it's a bottleneck, a challenge, a mental thing, what's stopping them?
Let's rewind a little bit from case acceptance because we have to ask ourselves, what do we really want out of this career? What do we want? Do we want to retire early? Do we want to clock out at 3 o'clock and just be present? Do we want to make $1 million a year? Do we want to have a $20 million net worth at whatever age? Do we want to become the cosmetic dentist of the year in our state? Like, we just have to think, what is it that we want? And we have to go towards that purpose. Too many times the hamster wheel's just cranking, right? We're pedaling, we're going like crazy. And then as we're gasping and taking our drinks, we're saying, what am I doing all this for? I see my net worth going up. I see my house getting bigger, my car getting nicer, but I'm not happier. Like,
Yeah.
what is this for? And so that has to be set. And will that stay the same forever? Heck no. That can transition every couple years, right? I was just listening to something about Elon Musk this morning, just like, did we see him becoming involved with the government? Heck no. Like 4 years ago, he was way different. And I was like, yeah, exactly, because that's how we all are. But for right now, you have to have that magic landing point of where you want to be. Okay, cool. So we want to make, let's say, 500 grand a year. Well, I'm just throwing that number out. What am I going to have to do? Well, I'm going to have to produce at least $1.5 million of dentistry. Again, just saying something out there. How am I going to get there? Got a treatment plan 4.5 million. All right, how am I going to treatment plan that? I've got to be more open about ortho. I've got to probably get into implants. I've got to be honest about crowns when a lot of times I'm too scared and I just want to call it a filling. So yes, Paul, case acceptance, absolutely, but it's got to have a direction as to why. Where am I going with this? And do I
I'll
have a
tell you
holy
my
cause?
why. I'm going to actually play the role of the why here. I love the things you've shared. And I want to share as someone who talks about this a lot too. We're making the assumption that this is patient-centered production because that's what we're all doing, patient-centered production. So people give me grief sometimes, Spencer, and say, "Oh, if you produce more, it just means you're doing unethical work." And I actually say, when you produce more patient-centered production, you're helping more people. So the more you produce, the more people you get to help. But actually, this is what I want to share. What I would like is I'd like to enjoy my career more. What I would like is that in a 7 hour day, I get fulfillment out of what I'm doing. That's what I want. I want more joy and more patient centered production. I graduated from dental school and I thought it'd be fun, and I'm just not having fun out there. How does big time dental producers help me with that?
This is a super sensitive subject that I mentor on about production because you're totally right. I want to be very sensitive that we're talking about the right kind of production. We're talking about being patient centered. We're talking about being ethical, about being honest. But you know what I found a lot, Paul, is that we're ethical and honest a lot in our profession, but we look at the other side of the spectrum to where we're doing a lot of free dentistry.
Yeah.
Like when you're talking about doing some implants to hold a denture in because that patient just hates their lower denture. You're like, you know what? Let's do some implants in there. And then mid procedure, you're like, man, this person could really benefit from four rather than two. I won't even mention it. I'll just throw these two in and then I'll just give them the good news later. Too many people are doing that kind of stuff. So why not just be honest about it and be like, hey, there's a really great increase of benefit from going from two to four. And so there is a huge opportunity for a bunch of people who are already doing the production, but they're just kind of living in a little bit of fear of having those tough conversations of just billing for what you do. When's the last time that you took your car in and they had a bunch of things that they did, but they said, but guess what? Since you paid such a big amount, we threw these last two things in for free. They don't do that, but for some reason, dentists feel like they should. So yeah, it's doing the right kind of production, but it's just kind of being upfront about and billing for what you do. Because dental schools, they didn't give us a break. They didn't say, you're such a good student, you're in the top 10%, we're gonna give you a little break on your tuition. They still took every single dollar that they asked
I
for.
love this conversation, and it leads me to this because what you're sharing is, what I talk to people about is what do you want more of? And Dennis Job Connect, the sponsor of our Dental Nachos group, my other company, some people want more free time with their family. Some people want more schedule freedom. Some people want more to fuel the growth of a second practice. And we share that an associate can help with that. So if somebody's listening now and they say, you know what, I hear Spencer and Paul, this is what I want more of, then let's talk about the how. You've created this program, which already has gotten awesome reviews. I was sitting at a Mark Costas event and people had said, have you taken Spencer Greer's course? It was the first time I'd heard about it. I think we had DM'd a couple of times. So now bring us to the how. If someone's listening saying, okay, I'm with you guys, Paul and Spencer. I want more of this. I feel this way. How does this happen? Where do I have to show up? What does it look like? Walk us through that.
Yeah, thanks, Paul. I'm glad that those people shared that with you and that sometimes we can just let that slide by and just be like, oh, okay, cool. But just the fact that you recognized it, that means a lot. And honestly, It's the cost of 2 crowns, right? Not even the cost of 2 crowns, and it is I've made it such a no-brainer for people to just learn how to just do a little bit more, to bill more for what they do, to be upfront, to be honest. One of my favorite things that I teach people is that we've always demonized over-treatment. Well, I think that we should equally look at
I
under-treatment.
agree.
Stop under-treating and look at that as a bad thing too. So I just teach people how to look at things to where you're already doing the right stuff. Let me just add to it a little bit with your mindset, with what you look at, with your efficiencies. I mean, I don't need to tell people how to talk to to patients because there is like I listened to you talking to Mark on a podcast or something. I'm like, oh my gosh, Paul's communication. Like if people just wrote this all down, which Nick, my associate, does, he writes your stuff, and I hear him going in like, how can I make your life better today? I'm just like,
Yeah, thanks. I'm
he's an
glad.
implementer, right?
I
Like
love
people
that.
just need
Thanks,
to
Nick.
implement what you say. People just need to implement what they hear successful dentists who are interpersonal to do. And so I don't need to tell you all of these cool things to say because they're just floating everywhere. Write down 5 of them, write down 10 of them, and just make them part of your deal. How do people get better with me and my course? Well, it's through Zoom, so you don't even need to travel anywhere. It's on Friday afternoons, and so most people are free that time. But if they're not, I also give them the recording so that they can get to it soon before the next session. And it's multiple sessions. And I love how this next one is during January because it starts right when we all have new goals. We all have
Yeah.
new, just, what are we setting for the new year, for January, for the new month? And January sets out perfectly to where we're going to really help people to start just boosting. Just imagine this, Paul. You just boost your production by 500 bucks a day. 500 bucks a day, and you work 200 200 days in the year. You're increasing your production by 100 grand just by
Yeah.
doing $500
And
more a day.
one of the things I love this conversation. Thanks for the nice compliments about my word systems. When you do this with the hours in your day, and you shared before we got on, you may as well make as much money as possible, help as many people as possible. The order: help first, produce. I always say, if it doesn't help, it doesn't matter. Be proud to share and sell help. But I love what you said about demonizing under treatment, because I want to tell
Mhm.
one quick story from about a decade ago. I see a lot of new patients. We do implants. A woman came in and said, my dentist never told me I get implants. She took out a denture that was flopping around on the top and a broken down flipper on the bottom. And since I looked at her, and during the conversation, she said she had 10 cats. And I just thought that was a specific number of cats, because that means that you had 7 cats and you said not enough cats. So I judged her, Spencer, with my mind, not my words. So my mind said, you know what? I bet this dentist told her and she didn't want to pay for it. But I give everyone the chance to say no to the best option. So I said to this 10 cat patient, hey, we got different options: stay in all the time teeth, snap in and out teeth, dentures like you have. And at that point, I can pass off to my patient care coordinator. I used to do it myself. I went back to check probably Dental Town, which no Facebook at the time. And I said to Kate, what did 10 cat person do? I thought she'd say she walked out without doing anything. And she said she's going to bring a check for $27,000 next week. She wants to take advantage of the payment and full discount. And I said, oh my gosh, what a nice surprise. And that story is, if we don't judge our patients and give them the chance to say no to the best treatment, and why I'm so aligned with you, because under treatment is just as dangerous. Because that past dentist looked at her and said, I'm not even going to tell her about dental implants. And I'm not demonizing him, but I just love what you've shared, that when you put these things out there to people, you can change their lives. And it sounds like that's a big part of this training program.
Yeah, one of my favorite things to do is just throw my hands up. When I'm talking to patients, I just say, "Hey, I just need to let you know what this option is because if I want to sleep tonight, I just want to know that I gave you all your options." There's there's a Rolls Royce option for you for 60 grand. And I kind of read the situation. If they're just like, oh, I'm like, that's okay. That's okay. Just wanted you to know that you could go to the surgeon, you could go do that. Cool. Let's go to the next step. And so it's just really important that you just kind of start with the best. I mean, I remember in dental school, this prosthodontist gave this lady this super comprehensive treatment. I'm just like, she's not gonna pay for that, doctor. And he's just like, but I'm still going to give her the best treatment. Just didn't make sense to me because I was very cost conscious. These
Yeah.
people were getting super discounted dentistry. But, that was the first time that I ever heard about just, diagnose comprehensively. And does that mean, okay, this is super important. Does that mean that you give the best option, you walk out of the room, and then the office manager, treatment coordinator, whatever person comes in with that option? No. It is up to you, the doctor, to read the room, to figure out if this is going to work out for them or not, and then to kind of step down, figure that out, diagnose the one best option for that patient so that treatment coordinator brings in one solution rather than three clipboards with a bunch of different treatment plans where the person goes, I don't
Yeah.
I don't even know how to do the alphabet right now because you're just confusing me, right? And so it is up to us. We are the captain and people will follow suit. Just like we're the captain, and if we're like, you know what, I'm gonna increase production by $1,000 today, that's up to us. It's not up to serendipity. It's not up to the Google marketing ads. It's up to us. We create. And so if somebody's just like, if we see a little bit of crooked teeth on the bottom, and we say, does that ever bother you? They're just like, yeah, I think it looks really ugly in pictures. Oh, okay. Did you know that there's a non-invasive way that I can help you to fix that?
That's awesome.
And and so people are like, oh, too much production. Well, are you talking about something like that you notice? We've all seen that number seven that's rotated on a pretty person, and so mention it. Don't be scared. You're a tooth expert. You love teeth. And so as we mention that rotated tooth on there, just like, hey, you got a really pretty smile. I noticed
I
that
want to
this
go to the
one's
next
rotated.
topic. I love what you're sharing, but I took off my shoe because these are Hokas, and inside of them is this insole, and I tell this a lot. So at a shoe store in Philadelphia, a nice one, I went to buy new sneakers, and I tend to be a pretty friendly person, but I don't just say I'm going to buy everything. So I bought these sneakers, and the salesperson had the courage, okay, Spencer, and cared about me enough to say, have you ever used insoles or orthotics? And I said, oh, yeah. 8 years ago, I got this pair custom made. I never wore them. They were too hard. And she goes, I totally get you. Do you know here you can step on these things and for like $80, we can give you customist orthotics to help you with your walking and feeling better. It was 5 years ago. I have since bought one pair a year, and I am grateful that that person had
Yeah,
the courage to sell me help. I am grateful that that person didn't lack the self esteem I lacked early in my career and said, oh, we could patch it. We can patch it because I wanted to talk about $400 instead of $2,000. And what's awesome about your
yeah,
program is you're making this accessible. It's on Zoom. People get a special discount for being part of Dental Nachos. And you've had a transformative impact on some of these people. So whether you call them out by name or just talk about them, the people that you've taught through this version already, what are some of the things they've gone and done in their dental practice as associates or owners?
yeah. I mean, I just want to visit one thing before I answer that
Sure.
question. Everybody makes money, pretty much, right? Everybody who's coming in here, they make money. They understand that money is to be spent. Don't feel bad for requesting that that money be spent on your product or on your service. It's okay. I'm giving everybody permission. You can ask people for money in exchange for your service because you're going to better their life with that investment. Now, is this an investment or an expense? That depends on how much value you transfer to the patient. So, your question, I was with an associate doctor named Regan, and she was an attendee for a month, and then her boss paid for just some continual mentoring with a couple of these associates, and I just saw, just within a month and a half, just the confidence that Regan had to really take the bull by the horn in her practice as a new grad associate to talk to the office manager of like, no, I'm not going to do all the fillings around that number 14 crown. I'm going to do all the fillings and the crown because that's how we do things around here. Whereas before, she didn't do that. And my assistant, Kristen, was on the phone call with me afterwards. I'm just like, did you see the confidence, the difference of Regan's face before and now? And she was inspired. My assistant was. And so, it is something to where people don't realize what they don't know yet. Because when we go into this dental practice, you talk about this all the time, Paul. We are it. Assistants get to hang out, front office, they all get to hang out. We're it. We don't get to really feed off of each other too much. So what do? We go to online Facebook forums. Sometimes we go to CE. And when we go to those CE, we feel enriched, right? We're like, wow, it's because of all the power, right? And so I need to empower people. People need to be empowered, but they don't know where to find it. And so that's what they're getting out of this. And that's the testimonials that people have given me is that they feel empowered to go from producing 2,000 a day to 5,000 a day, to go from producing 8,000 a day to 12,000 a day. You mentioned my associate Nick, who graduated in 2022. The the daily goal in that office is a minimum of 18,000 a day.
It's
Are they
awesome.
doing crazy all on X stuff? Absolutely not. But it's just being upfront, it's doing same day treatment. And so this is something super pertinent to everybody, whether they're an owner, whether they're an associate, and we all just want some more fulfillment. And we want some more, some higher earnings for all of the stuff that we're putting in. Because don't forget, you applied to dental school, and that was a really crappy experience. Don't forget, you were in that first embryology class in D1, and that was a really crappy experience. Don't forget all of the hardships that you've gone through to get to this point in your career. So yeah, you're deserving.
I absolutely love that impact that you share. Nick is amazing and Regan. And you get to transform how dentists feel about themselves, and that matters. I always say the morale of the person holding the handpiece prepping your crown should matter. You help people with this. As we kind of wrap up, what is the investment and the nacho discount that you're offering our community? So if someone's like, hey, I got to save the money, I want to ask for it from my boss, I want to split it with them. What is the cost for someone to be part of this awesome experience, the 5 week Zoom workshop for big time dental producers?
Yeah, it's 21.95, and then I'm giving all your people 10% off.
10% off with, I love the discount code salsa. And as I wrap up this, and I know, we're such kindred spirits with this, many of us get frustrated understandably by a patient who says, I can't do these two crowns. I'm about to go to Disney World. I can't do this filling as I leave with my $5,000 handbag. Because to us, Spencer, it's inconsistent, right? To us as the dentist, it's inconsistent. Well, I'm going to hold the mirror up to dentist and say, you need to role model the same investment in your career that you expect dentists to do, your patients to do in their mouth. My friend Dr. Todd Fleischman has spent 6 figures on Kois and Spear and investing in himself. And he'll say, I would do more. I wish I did it sooner. So don't be the patient or the dentist who says, I wish I did this sooner. Do it now, because then the benefits, the real ROI, which I share, Spencer, is return on investment and relationships, opportunity, impact, is Nick's lucky. He's a 2022 grad. I'm a 2002 grad, and people can learn this at such early stages of their career to transform their life. Is there anything else I missed, Spencer, you want to share with our audience before we wrap up?
Yeah, I just wanted to make this as much of a no-brainer for people as possible. It's just something that is super doable, immediate impact. And there's a lot of times where we don't bat an eye to tell people, yeah, a crown and a buildup is $1,800. But then when we get quoted $1,800
Yes.
for tire tire replacement, our stomach goes into a knot and we develop that ulcer. Just realize out of empathy for these patients that you're treatment planning, you need the same investments for yourself. Invest in yourself. Let me help you because this is something that will be an immediate ROI. Totally. All you have to do is just incorporate a couple of those things into your mindset or into how you look at the workflow or just how you talk to patients just a little bit. It's so easy, it's so doable. And so I just want this to be something of an immediate impact on you. If people are an associate, a lot of times their boss would be super pumped about them doing something like this. I've met a lot of bosses who have attended the course with me and their associate did too. And they said, bro, I've taught my associate that same thing. You don't realize how good it was to have somebody else tell them that
Yeah.
same thing, right? It's just a reinforcement. I've had associates who their bosses have paid for it, and they've really taken that bull by the horns. So I want to make sure that from all aspects, if you're an owner, if you're an associate, let me help you. And I really want you to just remember, like I love that phrase from Darcy and from you. Don't be dentist cheap.
Yeah.
Just put it in and let's get cranking with it. I want to help people to crank and make life a little bit easier.
Love it, Spencer. So proud to be collaborating with you. People can text time to 215-543-6454. Invest in your success, invest in your sanity with Spencer. Have a great rest of the day, Spencer.